Welcome to the NurtuHER Series, where we're supporting Black families before, during, and after birth.
My name is Jamilah Muhayman. I'm a Healthy Start Doula here at Community of Hope and a native Washingtonian. I'm proud to work here and support women in DC. The work I did before becoming a Community of Hope doula, I worked as a perinatal care coordinator, and I supported the families that were in our homelessness prevention program. And so we worked to kind of help families that were unhoused and pregnant ensure that they got the care that they needed to have a healthy and successful birth. When thinking through the healthcare system and focusing on folks that are unhoused, it's important to realize that they have so many competing factors that it can be hard for them to really focus on their healthcare and all they need. I work primarily with folks that are pregnant, and as much as they want to ensure that they have a healthy pregnancy, when they are unhoused, there are many other factors that kind of come before taking care of their pregnancy and attending regular prenatal appointments. So part of what my role is to help support them in focusing on the health factors, and then their housing case managers support them in securing housing. The holistic approach to healthcare works the best because it takes into account all the things in a person's life that can impact their health. A lot of times in the medical setting, we just kind of focus on data and numbers, but when you look at the whole person and their social life, their home environment, even their past history, it helps you inform you better about how to care for the whole person. The work that I did actually kind of helped to feed me as well as a person that was experiencing pregnancy. It was just an unspoken connection. Like, we are experiencing these similar things at a similar time, and I'm able to support you. My birth story of hope, my last pregnancy, it was a bit of a high-risk pregnancy, but kind of having the support of my community and family and the work that I did kind of really helped me feel like I had the strength to make it through. And I had a beautiful baby boy born full term, which was a first for me. So it was a wonderful experience. I think the thing that was most helpful to me, and another colleague in the birth space shared this with me, take the time to grieve the birth that you wanted and then embrace the joy in the birth that you had. Like, find the silver linings and all the things that you experienced. The most rewarding part about being a doula is the satisfaction that families have with their birth outcomes. Things can be challenging in the world we live in when it comes to birth, especially with families that are Black. And so being there to help them advocate and have the birth that they dreamed of is what kind of gets me out of bed every day. I think with my role at Community of Hope, as well as the work I do in the community, helping to support other doulas, it's kind of shining a light on the work that we do and the ways that we can support improvement in the maternal health crisis that we're currently experiencing. Doulas are one of the ways that a lot of studies have shown can improve the rates for Black birthing people. What's giving me hope about the future of Black maternal health equity is the number of people of color that are getting into the work. When your providers look like you have better outcomes. And so to see so many Black and brown people choosing this as a career path gives me hope that things will look different in the future.